Hi, it's Dr. Ariel Schwartz here. I wanted to share with you something that has been kind of interest to me lately, and I thought I'd speak about it for a moment and share it with you. You may have already come across this, and I want to share how I'm integrating this information. And it has to do with the research of Dr. Andrew Huberman, who is at Stanford University, and his research on vision and coming across the value of eye movements as it relates to the neurochemistry of courage. And what I find fascinating about this as an EMDR therapist and as a trauma therapist is how it helps to explain a little bit more about the value of adding eye movements when we're turning towards difficult memories from the past. And what his research was looking at is that when we're moving forward in space, especially, for example, if you're walking through space, that our eyes are naturally scanning our environment, right, to take in what is around us to help us navigate the world. And of course, we can also imagine how animals, right, imagine the tiger walking down the trail or a deer or whoever it might be, are navigating their world. And it both helps us recognize where our sources of food, where our sources of predators, right? And it helps us survive. So when we're turning towards difficult memories, it takes a lot of courage. It really requires that we build up that capacity within us to do hard things. And when we are moving towards something that's difficult, why not pull into our sphere anything that helps us navigate that most courageously? Now, one of the other beautiful gifts of EMDR is the recognition that we can also add in these bilateral movements simply because they feel good. And actually, what Dr. Huberman found is that with the eye movements, that there's also the release of dopamine. Dopamine is a feel-good reward center, it's a reward neurochemical that increases our sense of pleasure. So we can also build what we call resources in trauma therapy, or that ability to build positive state, and eye movements can help with that as well. So I wanted to end this short share with just a little bit of encouragement for you to build some positive state with me and maybe a practice to do so together. When we look at the work of the vagus nerve and the healing power of the vagus nerve, particularly Stanley Rosenberg's book of that title, he brings in eye movements as well and recognizes that when we bring our eyes from left to right, that we are also simultaneously helping to release the muscles in the occiput that tend to get tense and tend to basically kind of manage or control our experience in the world. But when we feel safe, we can soften through these muscles, we can let go, we can release, and it also helps increase blood flow to the vagus nerve that's traveling right through the two sides of the back of the neck around the occiput. So he also speaks in there about alignment of the upper cervical vertebrae and increasing blood flow to the vertebral arteries there. So, okay, let's go into a little bit of a practice together. So this is what Stanley Rosenberg speaks to as the basic exercise in his book. And some of you have practiced this with me before. If this is new to you, I will offer it to you seated, although you can also practice this laying on your back with your arms supported behind you on the floor. So it can feel less effortful to do this laying down. And if you're doing this seated, maybe you join me by bringing your hands to the base of your skull. And I'll just encourage you to find any position here that just feels supportive, right? Like you can allow your thumbs to come down. You might even pause for a moment and just massage the muscles around the sides of your neck in a very gentle, soft manner. Just allowing yourself to sense and feel the tone of muscular action in your neck. Maybe just sense and feel the general state of your nervous system for a moment. And then with your hands gently holding your head, feels good, right? I've even widened my hands a little bit here just to have that support. And then allow your eyes, I'm going to go to the right side first. You get to choose. Just allow your eyes to come to the right, as if you're trying to look all the way to your right elbow. And as you rest with your eyes in this position, just allow yourself to tune inward. Maybe noticing your breath, your heart rate, the feeling of your heartbeat in your chest. Noticing any subtle changes in temperature in your body. Maybe an urge to swallow. I just caught that one. Maybe a feeling of a yawn. And then slowly bring your eyes to center. I'll invite you just to rest your arms for a second. So your eyes to center, arms resting by your sides, and just notice. So for me, I feel a lot happening. I can feel my heart rate actually, it lifted a little bit and it's slowing back down. I feel like I can take a deeper breath. All right, let's find side two. So again, whatever position, and I've taught this before. Some people can't bring both arms up, just do one. That's fine. All right. And whether your elbow's there or just your imagined elbow, taking your eyes all the way around to the left. All the way as if looking at your left elbow. And you're not forcing change on yourself, right? With all of these, it's an experiment. It's a being with yourself. It's offering curiosity to your own experience, which is a real gift. And then staying here or maybe waiting a little longer, you can choose for yourself, maybe tracking if there's been a swallow or a yawn or some notable shift. And then letting your eyes come back to center, letting your hands come to rest. So once again, I feel like a lot's going on. My nervous system just dropped like 5 notches, which I'm okay with because in this world we have a lot of stress and it's good to drop down a notch or two sometimes, isn't it? I hope that you got some enjoyment out of that and some pleasure. One last piece that I'll just add to this mix is that you can, with your hands over your heart, just take a few breaths and let your eyes go side to side. Just allowing a little bit of integration between left and right sides of your body and brain. Especially if you felt a little flush of pleasure or ease in your body from the static holds, just let that grow and build. And then slowly coming back to center. If you feel a little bit woozy or dizzy, go gentle with these practices. All right, it can move a lot. We're really getting into the brainstem and into the muscles at the base of the skull. So sometimes it can take a little bit of time for your vision or your body to recalibrate, even in just a very short practice of 4 or 5 minutes. So thank you for joining me, and until next time.